Our third discovery is about food sensitivities. There's a lot of misunderstanding regarding the difference between food allergies, food intolerance, and food sensitivities. And I am fully aware that there are controversies and diverse opinions about the validity of such tests. Today we have hair analysis, urine analysis, saliva and blood analysis for allergies and food sensitivities. And with all of these steps, there are pros and cons. I have done hundreds of blood chemistry analysis of my patients' labs throughout the years in my practice. And I'm talking about blood that is drawn in labs like Quest or LabCorp or the local hospital. They're looking for complete blood count and metabolic panels, lipids, that type of thing. So it stood to reason for me to use blood analysis for food sensitivities. And technology has come a long way that while these tests are not perfect, they do have clinical significance when contrasted to the patient's symptoms. Now, the gold standard for food sensitivities is an anti-inflammatory diet for at least 21 days or longer. I prefer 30 days. Or an oral food challenge where the suspected allergen is consumed and the patient's symptoms are observed. And an anti-inflammatory diet is part of our optimal digestion blueprint. However, the problem is that sometimes the reaction to a food is not immediate. Sometimes it can take 24, 48, and even 72 hours before you experience any symptoms. So it's very difficult to pinpoint the offender. Heck, I can't remember what I ate a couple of days ago. So by looking at the blood sample and seeing the types of antibodies the immune system has made to foods it perceives as offenders, we're able to better tailor an anti-inflammatory diet that's unique for you. Let's learn to tell the difference between food allergies, food intolerance, and food sensitivities, shall we? When someone has a food allergy, she knows it within a few minutes and to an hour. Like when someone has a peanut allergy, symptoms come on quickly. A food allergy is when your immune system mistakes an ingredient or type of food for a harmful substance. This is key, a harmful substance or a pathogen. When this happens, your body produces chemicals to fight the perceived threat. This immune response causes symptoms such as a runny nose or itchy, watery eyes. The body's response is immediate, and symptoms usually occur within 30 minutes to 2 hours. The following foods account for about 90% of all allergic reactions, such as fish, shellfish, eggs, soy, tree nuts, peanuts, milk, wheat. Now, another reaction is called anaphylaxis. And this is, in some people, this reaction is more severe and can even be fatal. In these cases, ingesting or touching a small amount of the allergen can lead to a rapid acute reaction called anaphylaxis. Anaphylaxis usually starts with extreme itchiness on the face or in the eyes. Within a few minutes, the following symptoms may also occur. Difficult swallowing, swelling of the tongue, lips, or throat, shortness of breath or wheezing, a red rash or hives, abnormal stomach pain, cramps, diarrhea, or vomiting, tightness in the chest. Anaphylaxis symptoms typically occur within 5 to 30 minutes. If you notice the warning signs of anaphylaxis, it is vital to seek medical help immediately, or take your prescribed allergic medications, or use the EpiPen that your doctor prescribed. Failure to do so can result in more severe symptoms such as drop in blood pressure, increased heart rate, or unconsciousness. Now, let's take a look at food intolerances. Food intolerance is the inability to digest or process certain foods, often due to poor pancreatic release of the right enzyme. Food intolerance symptoms are inconvenient and uncomfortable, but they are not life-threatening. Unlike food allergies, they do not involve the immune system. They usually show up within a few hours of consumption and may include the following: bloating and gas, diarrhea, stomach pain, heartburn, nausea. The most common food intolerance include lactose intolerance, gluten, wheat, rye, and barley, found in foods like bread and pasta, histamine, found in foods and drinks like wine and cheese, caffeine, found in coffee, tea, and some fizzy drinks, alcohol, sulfites, found in cider, beer, and wine, salicylates, found in some fruits, vegetables, herbs, and spices, monosodium glutamate, MSG, found in ripened fruits, cured meats, and savory foods, and often in a lot of restaurants they'll include the MSG. And all of this altogether are intolerances. They're not life-threatening. They do not involve the immune system. Just means the pancreas is not providing the right amount or the enzyme that's needed to deal with that particular substance. And now finally, let's talk about food sensitivities. Food sensitivity is when a certain food prompts the immune system to create internal inflammation. By contrast with food allergies, where the immune system mistakes an allergen such as a protein from food as harmful, as a pathogen. So the reaction is different and not as drastic as food allergies. Food sensitivities can cause joint aches, chronic allergies, congestion, chronic skin rashes, bloating, constipation, diarrhea, and migraine headaches. The most common food sensitivities include non-celiac gluten sensitivity. Now, you see, you don't have to have celiac disease to have a reaction to gluten. Nightshades sensitivity. Sometimes after you do an anti-inflammatory diet and you're still having symptoms, we might decide then to remove the nightshades type of foods. Tyramine sensitivity. This one is a big one with women who suffer with headaches and migraines. Aspartame sensitivity, caffeine sensitivity, food coloring, MSG, monosodium glutamate, and sulfite sensitivity. We test for 88 foods. The test shows which foods you may be allergic to, sensitive to, or have built a tolerance to. And it was with a blood sensitivity test that we were able to customize an anti-inflammatory diet for Laura. Laura had a mixture of complaints that overlapped with various GI disorders, including H. pylori. Before bloating, diarrhea, constipation, nausea, chronic runny nose, hives, anxiety, itchy skin, rosacea, and acid reflux. She had tried everything: over-the-counter antacids, topical creams for the itching, laxatives, antihistamines. Her doctor put her on H2 inhibitors to help with the acid reflux. After following the protocol, Laura now lives a happy life, normal life. The symptoms that made her life miserable for so many years have abated and are now a thing of the past. Her skin is lustrous, her sinuses are clear, she has lost weight, and she feels good and great about herself. And we were able to help her because we didn't guess. And the food sensitivity test helped us tailor her anti-inflammatory program to remove foods that even she was not aware were causing some of her problems. And she's so much better now. And now we finally come to what you have so patiently been waiting for. The 3 simple steps that have helped many of my patients and will make a difference in your life should you take further action. Remember these 3 boxes that I alluded to earlier? Well, now I'm going to show you the 3-step system I use to help clients, like those I've shown you, to achieve such remarkable results. It is the Optimal Digestion Blueprint. The Optimal Digestion Blueprint is simple and it works every time, and it has 3 steps. The first step is remove. This step is crucial in your healing journey and will determine everything you do afterwards. But what do I remove, you may ask? Well, depends on what we have found on the tests. Your story is probably similar to that of Laura, Carol, or Linda, but it is also different in so many ways. We could guess what to remove, but why? Don't you want to know? As a coach, I certainly do. But I'll give you some ideas. There could be an overgrowth of some of the commensal bacteria. We already discussed what commensal bacteria is. There could be some that's overgrown. We would like to lessen that and bring it to harmony with the rest of the microbiome. Perhaps there is H. pylori. You certainly want to remove the nasty little bug from your body. Or maybe there's a particular food that produces symptoms 2 to 3 days after eating it. I don't remember what I ate 3 days ago, but with a food sensitivity test, we may just be able to zero in right on that food. And please understand that removing food does not necessarily mean for a lifetime. We remove it long enough to tame the immune system down and lessen the inflammation. Research shows that after a while, one is able to eat that offending food again once the immune system stops thinking of it as an allergen. After we remove, we must replace. Again, you may ask, replace with what? First, through testing, we see what we are missing. For example, if we see too much fat in the stool, as you've already learned in this masterclass, we may have an issue with bile. Remember, we said that bile was important for breaking down the fat that we consume in our diet. So perhaps we should consider replacing with bile supplements. So see, again, we're not guessing. And while we talk about fat malabsorption, you may consider that fat-soluble vitamins were not properly absorbed. Perhaps you would consider supplementing with some of these vitamins. Maybe we see in the stool test that the pancreas is not providing enough enzymes to break down food. Well, maybe we should consider pancreatic enzyme replacement therapy. And one more thing about replacing. The stool test may show that some of the commensal bacteria is low. This can happen sometimes due to extreme diets, like a ketogenic diet, for example, where not enough resistant starches or polyphenols from vegetables or fruit are being provided for the commensal bacteria to grow. We might then replace some of the foods in our diet with foods that provide nourishment to the microbiome. See, we're not going willy-nilly here, taking this or taking that just because someone on Facebook said to take it. We're asking your body what it needs and what it does not need by testing, not guessing. And now let's talk about repair. Repair is the final step. You will start to slowly rebuild the intestinal wall. You will learn about providing the fuel that the cells in the intestines need to function properly. The fuel for the small intestine cells is not the same as the fuel for the cells in the large intestine. With this fuel, the cells are able to repair the damaged collagen and the tight junctions that were destroyed and led to a leaky gut. You will learn to repair the mucosal lining that protects the cells in the intestines and that provide a barrier against pathogens. You will take your newfound confidence and wisdom to live a life where you're no longer at the mercy of your gut. You will learn to repair that relationship of mutualism that we spoke about earlier, where you benefit from the microbiome, and the microbiome benefits from you, the host. And together you can enjoy food again, eating from the same dish. Now, these 3 steps are not a cookie-cutter type of solution or one-size-fits-all kind of thing. Each one of my clients are different. So there are times when we may need to repair first and remove later. The order in which these steps are taken is really determined by the results of the tests. Now, because you've stuck with me so far in this masterclass, I'm going to give you something that you can put into action immediately. It may not resolve all your digestive issues, and then again, it might. But it will serve as a starting point and certainly get you on the path to better digestion. And remember, you can put this to work right after this masterclass. Let me introduce you to the migrating motor complex. This is a specialized type of peristalsis or muscle contraction that occurs in the small intestine in the fasted state. Keep this in mind. In other words, when you're not eating. It consists of rhythmic contractions that begin in the stomach or small intestine. You see, The GI tract from the esophagus to the anus is a layer of smooth muscle. This smooth muscle responds to electrical signals that are issued from a series of cells that are called the interstitial cells of Cajal. Cajal was a Spanish neuroanatomist. These cells are thought of as the pacemaker of the gut. And just like the pacemaker of the heart that sends electrical signals for contraction of cardiac muscles on the atria and the ventricles to pump blood, so do these electrical signals cause contraction and relaxation of the intestine smooth muscle, a process we know as peristalsis. These events, the contraction and relaxation of the smooth muscles, take place every 90 to 120 minutes. But as I said above, in the fasted state, when you're not eating. And it will last around 1 to 3 hours to complete. Now, the purpose of the migrating motor complex is to sweep the GI tract clean during periods of fasting. It performs a housekeeping function, if you will, in that it prevents bacterial overgrowth due to stagnant food contents. The hormone mutulin is thought to be responsible for the initiation of the migrating motor complex, and mutulin is secreted by an empty stomach. So when we're in a fasted state, there is no food in the stomach, this hormone is released to initiate the migrating motor complex. Now here's the interesting part, and one that you should pay attention to. If we eat, this system stops immediately. The intestines shift their function from cleaning to digestion. And it doesn't have to be a big meal. It can be anything you put in your mouth. A piece of celery, a cookie, a carrot, anything that the body perceives as having calories. Drinks like juice, milk, sweetened coffee and tea, and sodas all have carbs or fats or proteins, or any energy or calories containing nutrients that we take will stop the house cleaning work of the migrating motor complex. So if we are grazing throughout the day, this becomes a problem because now we've allowed bacteria to multiply to continue fermenting leftover undigested food, leading to bloating. And it is thought that this interruption of the migrating motor complex by constantly eating will lead to SIBO, or the small intestinal bacteria overgrowth that we talked about earlier. This is why intermittent fasting has helped a lot of people alleviate digestive problems. When you fast, you are giving the intestines a chance to take the garbage out, so to speak. So put this into action right after this masterclass, and you will see the benefits. And if you have any questions, well, we can talk about it later. Now, let's continue.